And in today's class, I'll try to explain some classifications of epilepsy, pathophysiology, and different categories, different classes, different types of epilepsy. And I'll try to explain the anti-epileptic drugs, pharmacology. Okay. In single class, I can't complete total concepts from epilepsy, but in today's class, we'll try to complete the disease classification and drug classification, okay, and mechanisms, and a few other important concepts from pharmacotherapy we will see. Okay, let's begin the session. See, before understanding the anti-epileptic drugs, first we need to understand some basic points about epilepsy. See, we have three different terms. The first term is seizure, second term is convulsion, and the third term is epilepsy. First, we need to know the difference between these three terms. Okay. First, can anyone tell me what is the definition of seizure? This seizure means it is a condition where sudden or excessive generation of action potentials. Sudden excessive generation of action potentials from the brain. Action potentials in the brain or in the nerves. Okay, see, just imagine this is brain is made up of two lobes. Okay, imagine here, somewhere here in the brain, some tissue is got it, some brain tissue is necrotized, or brain tissue is destroyed. So what happens, this destruction of the tissue in the brain, what it does, it will cause sudden excessive generation of action potentials throughout the brain. The destroyed tissue in the brain, what it does, it will aggravate, or it will trigger the excessive generation of action potentials in the brain. This uh, this sudden excessive generation of action potentials in the brain is called seizure. And this sudden excessive generation of action potentials will travel from one nerve to the other nerve, and this action potential again travels to the tissues, and in the tissues, these action potentials, sometimes it causes severe contraction of smooth muscles, skeletal muscles, especially skeletal muscles. These seizures will travel throughout the body, and in the body, on the tissues, it causes contraction of skeletal muscles. When skeletal muscle contracts, severe contraction and relaxation, simultaneous contraction and relaxation, this contraction and relaxation of skeletal muscles will cause movement of muscles, continuous movement, jerking movements बोलते हैं, jerks, jerks, jerking movements, rapid movements. These jerking movements or movement of the skeletal muscles due to seizures is called convulsion. Okay, see, simple difference between seizure and convulsion is, seizure is nothing but sudden excessive generation of action potentials in the brain or in the nerves. Due to the seizures, the action potential travels to the all parts of the body, especially skeletal muscles or other tissues, and it causes jerking movements. This jerking movement is called convulsion. So convulsion and seizure are almost same. See, in seizure, see, not all seizures will cause convulsions. All seizures will not cause convulsions. Why? some seizures seizures means generation of action potentials in the brain. If the seizures are present in the brain itself, if it is not traveling from the brain to the other tissues, if it is not traveling from the brain to other tissues, it will not cause convulsion. So all seizures may not cause convulsion. One thing you should remember, seizure may be with convulsion or without convulsion, and convulsion is nothing but jerking movements or severe contractions of tissues. And see, if any patient has 2 to 3 continuous episodes of either seizure or convulsion, they are called patients with epilepsy. So epilepsy is the disease condition, epilepsy is the seizure disorder, epilepsy is the convulsion disorder. Okay, epilepsy is the disease. Understood, everybody? I think you all understood the basic terms, basic meanings of these three terms. Am I clear, right? Shall I proceed to the next slide? Now, some more basic points I would like to tell. See, first important thing, in seizures, we have mainly two types. First type is focal seizures. Focal seizures are also called partial seizures. याद रख लो, different textbooks में names will be interchanged. Okay, names will be different. Some textbooks will write only focal seizures. Some textbooks will write only partial seizures. So you should not confuse. So first type is focal seizure or partial seizure, and second type is generalized seizure. Generalized seizure. Okay, or complex seizure. Generalized or complex. Okay, see, what is the difference between focal seizures, generalized seizures? Focal seizure means, just imagine, this is a brain is having two hemispheres, right? Brain has two hemispheres. If tissue destruction occurs at particular point of the tissue in the brain, or if destruction or dysfunction occurs in single lobe, destruction or impairment or anything, it may be due to injury, it may be due to infraction, it may be due to thrombus formation, it may be due to stroke, whatever. See, single lobe, okay, destruction of the tissue or the nerves in the single lobe, or in one part of the lobe, this type of if this type of tissue is destroyed in the brain in single lobe or in single part of the tissue, that type of seizures are usually focal seizures. These focal seizures, what it does, it will travel from the part where it is originated and it goes to the tissues, and action potentials will go to tissues and it will cause convulsions. So focal seizures or partial seizure. Partial seizure means only a little part of the brain or single lobe of the brain is affected, and that is leading to seizures or that is leading to convulsion. That type of seizures or convulsions are called focal seizures. And in focal seizures or partial seizures, we have two more types. One, focal seizures with consciousness. Focal seizures, second one is without consciousness, with no consciousness. See, focal seizures may we have two more types. When patient develops seizures or convulsions with consciousness, patient will have consciousness, patient को conscience रहेगा कि what is happening to his body. Okay, so patient will be in consciousness. Sometimes what will happen, patients single tissue or single organ or single part of the limbs will be having jerking movements आते रहता, patient को पता चलते रहता, patient will be in conscious. See, for example, this left part of the lobe is affected. So what happens in focal seizure with consciousness? When left part of the lobe is affected, the right part of the right tissue जो भी है, right upper limb, right lower limb जो भी है, they will be having jerking movements sometimes. So patient will be in the consciousness. Okay, and sometimes what will happen, patient will have in the consciousness only, and patient will be feeling some strange feelings, strange smell आते रहता patient को, like delusions, hallucinations. Patient will be facing some strange feeling आते रहता patient को. Patient will be in consciousness only. So in focal seizures, patient may have jerking movements, patient may have strange feeling, and this patient will be in consciousness. And sometime in focal seizures, patient will not be in consciousness. Here patient will have convulsions, or patient will have anything, seizure or convulsion or rapid movement or anything. In that case, patient will not be in consciousness till the convulsion comes and goes. Seizure एक बार आके फिर चला जाता है. Seizure will stay for 2 to 3 minutes. It depends from patient to patient. In some patients, seizure will stay only for 1 minute. In some patients, it will stay for 30 seconds. In some patients, it will stay for 4 minutes. In some patients, it will stay for 5 minutes. If anybody has seizures more than 5 minutes, if seizure is continued for more than 5 minutes, that type of seizure is called, or that type of epilepsy or that type of convulsion is called status epilepticus. About this concept I'll tell you. See, here in focal seizures, patient will be with consciousness, patient will not be with consciousness. When patient is not in consciousness, यहाँ पे patient will not know. After finishing the seizures or convulsion, patient बोलेगा क्या हुआ था मेरे को, why did I fall down, ऐसा करके पूछेगा पेशेंट को पता ही नहीं चलेगा what happened. So this type of focal seizure without consciousness can be seen in the patient. So in focal seizures, patient will have seizures with consciousness, without consciousness. And second major type is generalized seizures or complex seizures. These are very important. Here what happens, in generalized seizures or in complex seizures, see, both the lobes of the brain will be affected. Both the lobes of the brain are affected. And in generalized seizures, we have we have 7 types. In generalized seizures we have 7 more types. यहाँ पे ध्यान से सुनो सब लोग. This is very 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 important. This is very important. In generalized seizures, both the lobes of the both the hemispheres of the brain are affected, and here in this we have 7 types. Let me tell you these types of generalized seizures one by one. In that, first one is very important, that is called tonic seizures. ध्यान से सुनो सब लोग. First one is tonic seizures. In tonic seizures, what will happen? See, just imagine this is the patient's body. मान लो patient is doing some activities. Patient कुछ चलते जा रहा है, doing some activities. Suddenly, in tonic seizures, suddenly patients, all the muscles will be contracted. Stiff हो जाते muscles पूरे. Total muscles will be stiffed. Muscles stiff हो जाते. And what happens? Patient will fall backwards. नीचे पीछे की तरफ गिर जाता. Patient will fall backwards. This type of seizure is called tonic seizures. याद रख लो, these type of seizures are mainly based on their type of origin and how they are showing symptoms in the patient. Okay, so if suddenly patients all the tissues are contracted, stiffness occurs, and if patient falls backwards, that type of seizure is called tonic seizures. Clear? Now second type, I will try to show you the image here. I think you understood what is generalized seizure, focal seizure. Okay, in generalized seizure, yes, in generalized seizure, the first one what we have seen tonic phase or tonic seizure bolte isko. Tonic seizure, what happens? See, patient will fall like this. Total tissues are contracted, pura stiff ho jate tissues, and patient will fall backwards. Okay, like this. This is called tonic seizure. Next, in generalized seizure we have clonic seizure. Or in clonic seizure, what happens? See, when patient falls backwards due to tonic seizure, immediately patient will have severe contractions. This type of contractions, severe legs and hands movement, भड़ मार लेते रहता patient. Severe contraction and relaxation, movement of the hands and limbs will be seen. That is called clonic type of seizures. And see, if tonic seizure starts to the patient, and immediately after tonic phase patient develops clonic, that type of seizure with the tonic and clonic, that type of seizure is called tonic clonic seizure. Initially patient was having stiffness, patient has fallen down, and immediately patient started developing the movements, hand and limb movements. That is clonic phase. First tonic phase होगा, उसके बाद clonic phase होगा. Clonic convulsion alone can be seen. Tonic convulsion alone can be seen. Tonic alone हो सकता है, clonic alone हो सकता है. If patient has tonic and clonic together, that is called tonic clonic seizure. Okay, just to understand, I have provided these images. I think you all are following me. Okay, first tonic seizure we have seen, next clonic seizure we have seen, and then tonic clonic seizure we have seen. Okay, and another seizure we have atonic seizure. Atonic seizure. See, in atonic seizure what happens? Immediately patient will have relaxation of the muscles. Patient will have relaxation of muscles पूरी relax हो जाते हैं. हाथ में कुछ फोन, सेल फोन, बॉटल, वाटर कुछ भी पकड़ते रहते ना, that immediately patient's all muscles will be relaxed, and immediately patient will fall front side. This is called atonic seizure. याद रख लो. In previous tonic seizure what we have seen, in tonic seizure patient's total tissues were contracted and patient has fallen backwards. And here in tonic, this is atonic means here no convulsions. In atonic seizures all the muscles will be relaxed and patient will fall front side. दांत वांत पूरे तोड़ लेता ऐसा गिर के. Okay, this type of seizure is called atonic seizure. Based on their signs and symptoms and based on their type of convulsion, we have different types of seizures. I think you all are following me. Okay, atonic seizure also finished. Now next is, see, this type of seizures are myoclonic seizure. Myoclonic, these are very very common type of seizures. Myoclonic seizures, whenever you go to pediatric department, especially in small age children, if patient had some malnutrition or due to abnormal development of brain or due to meningitis, whatever, there are so many causes. I'll explain those causes also. Patients, all the tissues, especially limbs will have severe contraction and relaxation. Severe contraction and relaxation. That type of seizures is called myotonic seizures. Myoclonic seizures. Myoclonic. All muscles will be moving rapidly, jerking movements होते रहता patient को. Here patient may be on the standing position or patient may be in the sleeping position, falling down, जो भी कुछ भी है. Here this type of seizures are called myoclonic seizures. This is the fifth type of seizures. Okay, and the next one, the sixth type of seizure is absence type of seizures. Absent type of seizures is that seizure, say this is mainly characterized by sudden sudden stoppage of consciousness. यहाँ पे क्या होता, patient will be reading something, patient will be doing some activity. Suddenly what happens, patient का consciousness चले जाता and patient will be looking somewhere. टीचर बुलाते रहते, फ्रेंड्स बुलाते रहते, पेशेंट्स को ध्यान नहीं रहता वहाँ पे. This type of seizure is called absence seizure. Sometimes what happen, patient will be walking on the road. Suddenly patient stops. Suddenly patient will stop and patient will lose the consciousness. Patient को पता नहीं चलता where patient is going. Okay, so this type of seizures are called absence type of seizures. In these seizures, patient will not have any convulsion. Okay, seizure रहता है here, but convulsions are not seen in this case. So this type of seizures are called absence type. This is the sixth type. And finally, the last one is seventh type of seizure is status epilepticus. This status epilepticus can be seen both in focal seizures or in generalized seizures. Both focal seizure में भी हो सकता, generalized seizure में भी हो सकता. Status epilepticus is nothing but the patient will have convulsion and this convulsion will stay more than 5 minutes. If patient has convulsions continuously more than 5 minutes, this condition is considered as emergency condition. And this emergency condition with convulsion is also named as status epilepticus. Immediately patient should be started with pharmacotherapy. Here actually in status epilepticus we will go with Lorazepam. याद रख लो, Lorazepam injections. Lorazepam is having rapid acting. It is having rapid acting as well as short duration of action. Immediately it will stop the convulsions of the patient. And we also have other drug of choice, but most commonly Lorazepam is commonly given in our hospitals. So this is one type of convulsion. Okay, now you see, I will try to explain you the physiology of convulsion. Convulsion क्यों होता है? What is the physiology of convulsion? Everyone should concentrate here. This is very, very important. Okay, are you all following me? If you understand the physiology of developing convulsion, it will be very easy for you to understand the pharmacology of different drugs. Very, very important. This is the actual epilepsy is starting here only. See, we in previous classes we have studied about nerves. Okay, just imagine this as presynaptic nerve or the nerve which is coming from the brain. Okay, presynaptic nerve, and this is postsynaptic nerve. It is just a junction. Okay, see, whenever one nerve in the brain, maybe presynaptic nerve or the nerve which is generating from the brain, when this nerve is stimulated, what it does, it will release some neurotransmitters on the adjacent nerve, and on the adjacent nerve the receptor will be activated, and through this nerve either be activated or deactivated. Activated means it will be either excited or it will be depressed. These depression or excitation reactions are mainly, this activity is mainly performed upon the generation of action potential from one nerve to the other nerve. Yes or no? When one nerve starts action potentials, this action potential will go to next nerve, and from there it will show its action, whether to stop the movement of the body or to excite the body. In that we have already discussed excitatory neurotransmitters and inhibitory neurotransmitters, right? Ab dekho, see, in this presynaptic nerve, just imagine in the brain one lobe or one hemisphere was affected. Just imagine patient is having focal convulsion, a focal seizure, okay, due to the destruction of one particular part in the brain. This affected area, whenever brain tissue is destroyed or whenever brain tissue is necrotized, immediately it will start generating action potential. This thing you should remember, and you should अंडरस्टैंड दैट कभी भी ब्रेन में टिश्यू में डैमेज हुआ तो एक्शन पोटेंशियल शुरू होंगे. Why action potential generates when tissue damages, that is till now it is not understood. When nerve tissue is damaged, it is generating action potentials. Why it is generating action potentials, it is not well understood. Okay, why it is coming sir करके मेरे को पूछे तो I can't tell you, but from there how it is generating, that we know. See, when this tissue is damaged, it is producing action potential. That action potential, this due to production of action potential, what it does, the presynaptic nerve, the first nerve, this nerve is having many channels on its cell membrane. Here we have sodium ion channels, sodium channels, and we have potassium channels, sodium potassium channels rehte. When action potential is generated in the brain, what happens, this sodium ions, these are called voltage gated sodium channels. Through these voltage gated sodium ions, sodium will enter into the cell. ध्यान से सुनो, initially the voltage gated sodium channels will be opened. Through that, sodium will enter inside the cell. When sodium enters inside the cell, what will happen? Positive ion concentration inside the cell increases, and that will cause depolarization, right? When the presynaptic nerve is depolarized, what will happen? Immediately we have calcium channels. When the presynaptic nerve is depolarized, the calcium channels, which are called high voltage gated channels, or high voltage gated channels, they are also called HVC, high voltage channels. These high voltage calcium channels are opened, and through this, calcium will enter inside the cell. Initially, voltage gated sodium channels were opened, sodium entered inside the cell. It is causing depolarization. Upon depolarization, the high voltage gated calcium channels were opening, and through these calcium channels, calcium is entering inside the cell. When calcium enters inside the cell, again the cell membrane will be depolarized, and what it does, it will squeeze the presynaptic nerve, and it will release the neurotransmitters which are present in the presynaptic nerve. Especially in this case, it will release glutamate. Glutamate is the excitatory neurotransmitter. In previous classes I explained excitatory neurotransmitter. Here, high voltage gated calcium channel opens, calcium enters, it will cause depolarization, and it will squeeze the glutamate neurotransmitter. Glutamate will release in the synapse, and this glutamate goes and falls on the two types of receptors. One is AMPA receptor, and the second one is NMDA, N-methyl D-aspartate receptor. Glutamate goes and falls on the AMPA and also on the NMDA receptor. When glutamate falls on AMPA receptor, what will happen? AMPA receptors will again open. Actually, this AMPA receptor were having sodium channels through that receptor. So sodium again enters into the postsynaptic nerve. Sodium enters, and again this postsynaptic nerve will be stimulated. And when glutamate falls on NMDA receptor, through NMDA receptor, calcium ions will be entering inside. When sodium and calcium ions enters inside the postsynaptic nerve through AMPA and NMDA receptor, here again we have separate calcium channels which are called T-type calcium channels. T-type calcium channels. याद रख लो, इसके ऊपर जो थे, they were high voltage gated calcium channels which opened due to opening of sodium ions upon activating sodium depolarization. And these T-type calcium channels are activated due to NMDA receptor activation and due to entry of calcium ions. Okay, and from these T-type calcium channels, again calcium will enter inside the postsynaptic nerve. So from the postsynaptic nerve, here in the postsynaptic nerve, sodium ions, calcium ions from NMDA receptor, and calcium ions again from T-type calcium channels. These three ions will increase the depolarization, and this will again propagate the activation of tissues, and it will cause convulsion. How many of you understood this physiology? First, through voltage gated sodium ions, sodium enters inside. Okay, depolarization occurs. This depolarization will open the high voltage gated calcium channel. Calcium will enter inside, and when calcium enters, depolarization occurs. Glutamate releases. Glutamate will go and fall on AMPA and NMDA receptor. AMPA receptor will mediate entry of sodium. NMDA receptors will mediate entry of calcium. This sodium and calcium, again what it does, they will activate T-type calcium channels. Calcium again enters inside the postsynaptic nerve. These Postsynaptic nerve, again it will be depolarized rapidly and it will propagate its action to the further nerve or further tissue and it will cause convulsion. Okay, now you see this physiology will be happening in our body. This physiology is commonly seen in our body, but still we are not facing convulsion. Why? Because when glutamate falls on AMPA and NMDA receptors, immediately what happens? Here we have inhibitory neurotransmitters also. Inhibitory neurotransmitter actually GABAergic neurons bolte. This GABAergic neuron, what it does, it will release GABA here. It will release GABA and this GABA will go and fall on the GABA receptor. Okay, and on the GABA receptor, when GABA falls, what it does, this GABA receptor will open chloride ions and chloride ions will enter inside the cell and it will neutralize the sodium and calcium which was released due to NMDA and AMPA. उससे क्या होगा, टी टाइप कैल्शियम चैनल्स ओपन नहीं होंगे and patient's convulsion is stopped. So always in our body the inhibitory neurotransmitters GABA and excitatory neurotransmitters glutamate, these both the actions will be equally seen. In epilepsy, what happens, in epilepsy or in convulsions, more activity of glutamate is seen. Glutamate activity is dominating the GABA activity. That may be due to the destruction or maybe due to the uncontrolled generation of action potentials. Okay, uncontrolled generation of action potentials, or it may be due to the genetic cause. In some genetic causes, what will happen, GABAergic nerve is not properly producing GABA neurotransmitter. If GABA activity decreases, what will happen, glutamate activity increases and it will cause convulsion. Simple, you have to understand. Just imagine, epilepsy is the condition where glutamate activity is increased and GABA activity is decreased. Due to this, what happens, inhibitory activity will be decreased and excitatory activity will be increased. This will cause convulsion. These convulsions can be seen in different conditions. I will explain all these conditions now, different causes. Yes, anybody, any doubt? I already explained in barbiturates and benzodiazepines, but still see, when GABA goes and falls, when GABA releases, GABA will go and fall on the complex channel. Actually, we have one complex receptor. This is a complex receptor which is having barbiturate site, benzodiazepine site and GABA site. And this receptor is mediated by chloride channel. When GABA falls on this GABA site, chloride ions will be opened and chlorides will enter into the cell. When chloride enters into the cell, what it does? It will neutralize the positive ions and through that it will stop the excitatory activity. Depolarization kam kar dega. Understood? GABA will, yes, GABA will go and fall on the GABA receptor. Actually, यहाँ पे GABA receptor में we have GABA A receptor बोलते हैं actually इसको, GABA A receptor. Actually, these are having 3 to 4 subtypes. This GABA is a complex subtype channel which is associated with chloride channel. Okay, anyways, these in previous classes we discussed. On this same complex receptor, we have barbiturate site and benzodiazepine site also. Okay, when barbiturate falls, same action like GABA. When benzodiazepine activates, same action like GABA. Chloride ion opens. Okay, anyways, now you see. Epilepsy or convulsion is the condition where GABA activity got decreased and glutamate activity got increased. In simple words, inhibitory neurotransmitter activity decreased and excitatory neurotransmitter activity got increased. This condition is called epilepsy, or this condition will cause convulsion due to seizures. Now, why patient will have seizures? I will try to explain you the causes of seizures. Causes of seizures. ध्यान से सुनो, this is very very important and very easy. Just try to remember the causes of seizures with a simple mnemonic. Causes of seizures, just remember it as vitamin, VITAMIN, vitamin D and E. Okay, see, now I'll explain you the causes. में क्या, what you have to remember, vitamin D and E. Okay, first V stands for vascular abnormalities. V stands for vascular abnormalities or vascular causes. In vascular causes, what happens, in the brain we have carotid arteries and we have very minute blood vessels. If patient has obstruction in the blood vessels or rupture in the blood vessels, obstruction or rupture due to hemorrhagic stroke or due to ischemic stroke, ischemia से होगा तो ischemic stroke बोलते हैं, hemorrhagic हुआ तो hemorrhagic stroke बोलते हैं. Or sometimes patient will have intracranial bleeding due to anticoagulants or due to hypertension. Subarachnoid hemorrhage बोलते हैं, subarachnoid hemorrhage. Okay, due to thromboembolism. So these are different causes. If patient has vascular abnormality in the cranial tissue, if patient has vascular abnormality, any of these, what will happen? The blood perfusion is not properly seen in the tissue, and the brain, which is having two hemispheres, any part of the brain, wherever the brain's tissue is not reaching or not perfused with proper blood circulation, that tissue will be necrotized. And that necrotized tissue, what it does, it will continuously, it will start producing action potentials. That is called seizure. This is first cause, vascular cause. Dekho, whenever you go to neurology department, patients will come with hemorrhagic stroke, ischemic stroke, or due to patient will come with thrombosis, patient will come with trauma, बहुत सारे हैं. So in that cases, convulsions are the first clinical presentation. याद रख लेना, convulsions, seizures होते रहता पेशेंट को. क्यों? Because of vascular cause. Understood? First one, V indicates vascular causes. Second, I indicates infection. In infection condition, especially infection in the brain. Infection में brain में कौन सा infection होता? Meningitis. Patient with meningitis, if meningitis is prolonged, it may cause convulsions. Brain damage होके convulsion cause कर सकता. So simple, infection is one cause. T is trauma is just, it may be due to the injuries, or कभी कभी we fall down, we break our heads, that is called trauma के वजह से फिर patient को क्या होगा? Hemorrhage होगा, arachnoid hemorrhage होगा, thrombosis होगा, damage होगा, whatever. So patient's brain will be damaged due to trauma. T indicates trauma. And here A indicates autoimmunity. We have some autoimmune disorders. Some autoimmune disorders like SLE, systemic lupus erythematosus bolte. These SLE antibodies will go to brain and it will cause damage. Okay, and sometimes arteriovenous malformation. A means, with A you can write two. One is autoimmunity and one is arteriovenous malformation. Some minute arteries and veins in the brain, if malformation occurs, even that also causes destruction of the tissue or necrosis of the tissue, brain tissue. Okay, and here M indicates metabolic causes. In metabolic causes, what we have? Sometimes patient will have hypoglycemia. Sometimes patient will have hyperglycemia. Patient will have DKA. Patient will have hyponatremia. Sodium levels कम हो जाते. Okay, all these are metabolic cause जो भी है. Due to metabolic causes also patient will have convulsions. Okay, and I indicates idiopathy. Idiopathic cause. Actually here we don't have exact cause. These idiopathic convulsions are mainly due to genetic reason. Okay, genetic वाले में idiopathic होते रहता. Suddenly patient will develop epilepsy. Patient will develop convulsions. All the tissues will be normal. Patient will develop convulsions. That type of convulsions are idiopathic convulsions. Okay, I is idiopathic. Vitamin N neoplasia. N indicates neoplasia due to cancer. Okay, brain में भी cancer हो सकता है. Okay, N is neoplasia, and yes, vitamin हो गया. And D indicates drugs. There are so many drugs that causes convulsions. Sometimes alcohol also causes convulsions. Sometimes overuse of drugs, toxic conditions causes convulsions. But there are so many drugs. Excitatory drugs जो भी है, CNS stimulants जो भी है, पूरे के पूरे overdoses में it may cause convulsions. Coma convulsions is the end stage of toxic concentrations of drugs. And finally E is eclampsia. Eclampsia is the high blood pressure in the pregnancy, which will cause preeclampsia. Eclampsia is the convulsion which is caused due to hypertension. Okay, so in pregnancy, actually elevated blood pressure in pregnancy is called eclampsia. And this elevated hypertension in pregnancy will cause convulsion, that is called eclampsia. If anybody has eclampsia, what will happen? Pregnant patients will have a lot of risk of abortions. Okay, that you have to understand. So these are different causes. I think you understood the different causes of epilepsy. Okay, epilepsy, seizures, we have seen seizure definitions, we have seen seizure types, and we have seen seizure causes and general physiology of seizures. Clear? Now I will try to explain you the pharmacology. अपने पास time नहीं है, फटाफट जाएंगे. There is lot to study again. Now you see, I think you all understood the physiology. Okay, physiology of seizures. So now let us start the anti-epileptic drugs. This anti-epileptic drugs is the standard classification I have taken from KD Tripathi, KDT. Here you see in anti-epileptics, I think my screen is visible to you, can zoom. In anti-epileptics we have barbiturates. In previous classes we discussed barbiturates. In barbiturates particularly phenobarbitone, ज़्यादा use नहीं करते, but in classification we have to study. Phenobarbitone is the example from barbiturates. And in hydantoid drugs we have phenytoin and fosphenytoin. Very very important drug, phenytoin. Very important. Hydantoin class of anti-epileptic. And we have succinimide class. In that we have ethosuximide. And in benzodiazepines already we have seen clonazepam, diazepam, lorazepam. Lorazepam just now I explained, it is used in status epilepticus, and clonazepam, clobazam. So these are benzodiazepines, and benzodiazepines are very very commonly used drugs as sedatives and hypnotics. Okay, and we have deoxybarbiturates. In that we have primidone, and we have immunostilbene. In these we have carbamazepine. Very very important drug again, carbamazepine and oxcarbamazepine. Carbamazepine is very important. And in aliphatic carboxylic acid groups we have valproic acid. Very very important. Another, so here we have phenytoin, carbamazepine, and valproic acid. These three are very important. And in phenyltriazines we have lamotrigine. And in GABA analogs we have gabapentin and pregabalin. These are GABA analogs, and these are newer drugs. In newer drugs, these drugs are very very innovative and new. They are having special mechanism. In that we have topiramate, zonisamide, levetiracetam, Gabapentin, Tiagabine, and Lorazepam. So these are different newer drugs which are considered as anti-epileptics, newer class. Okay, you revise this classification again tomorrow, day after tomorrow morning, you will memorize. Okay, so you should memorize all these drugs. Now you see, now very very important point, I am going to explain you the mechanism of each drug, mechanism of action of each drug. Just imagine this is a presynaptic nerve, the nerve which is originating in the brain, and this is the adjacent nerve, postsynaptic nerve जो भी है. ध्यान से कहीं लिख लो या ध्यान से सुनो. This is very very important, and this one is GABA nerve. Okay, see, I told you, see, whenever brain is affected, it will produce continuous action potentials, right? When continuous action potentials travels from one nerve to the other nerve, when it is coming from one nerve to the other nerve, when this nerve is getting excited due to destruction, how it excites, this nerve will be excited due to activation of sodium ions. Okay, sodium ions will enter inside the cell, and this entry of sodium ions will cause depolarization. And immediately what will happen, this depolarization will again, it will activate what? high voltage activated calcium channels, and through this calcium will enter inside. First channel is sodium channel, which is voltage gated sodium channel. Through voltage gated sodium channel, sodium enters inside the cell. Upon activation of brain, this causes depolarization. This depolarization will activate high voltage gated calcium channel. Calcium will enter, and here when the calcium enters, the glutamate which is stored in the vesicle will release into the synapse, and it will go and fall on the AMPA and NMDA receptor. Clear? Here glutamate will go and fall on this receptor. When glutamate falls on the AMPA receptor, what will happen? Calcium. AMPA से क्या होगा? Sodium. When AMPA receptor is activated, sodium will enter inside the cell, and when NMDA receptor is activated upon glutamate, NMDA receptors will release calcium, and when calcium enters, here we have T-type calcium channels. Here this calcium will enter. Just remember all these channels. Okay. Now you see, glutamate, when it is releasing into the synapse, it will not stay in synapse. What will happen? This glutamate which is released should re-enter back into the presynaptic nerve. That is called reuptake. Noradrenaline, serotonin, all reuptake we have seen. Yes or no? Did we see? Yes or no? रीअपटेक हो जाएगा और फिर से वो आएगा. दिस पॉइंट वी ऑलरेडी नो. Okay, see on the vesicle, याद रख लो, on the vesicle we have one very important receptor which is called SV2A receptor. SV2A receptor. When this SV2A receptor is stimulated, it will release glutamate. SV2A receptor कब activate होगा? You know, this SV2A receptor is activated when high voltage gated calcium enters inside the cell. This SV2A receptor activates and it will rupture and the glutamate will release into the synapse. It falls on AMPA receptor and NMDA receptor, and again it will promote or it will propagate the action potential and it will cause convulsion. And here the GABA will release from the GABAergic nerve. GABA will go and fall on the, here on the postsynaptic nerve we have complex receptor. It is having GABA subunit, barbiturate subunit, and benzodiazepine subunit, and this is mediated by chloride channel. Okay, when GABA releases, GABA will go and attach on the GABA receptor, GABA A receptor, and when GABA A receptor is activated, it will release chloride ions. Okay, this is the general physiology. See, GABA, when it is releasing here, GABA again, this should go back. GABA will be reuptaken, right? GABA is reuptaken by one channel which is called GAT1. GAT1. GABA transporter A, GABA transporter 1. Here we have GABA transporter 1. Through this GABA transporter 1, the GABA will be reuptaken and again GABA will release. Okay, so this transporter you should remember. Okay, and now you see when GABA is reuptaking back into the GABA nerve, here there is one very special enzyme which is called GABA transferase. GABA T. This GABA transferase enzyme, what it does, it will metabolize the GABA. It will degrade the GABA. These are different physiological points. Now I will tell you the drugs. ध्यान से सुनो सब लोग यहाँ पे. Everyone should listen very carefully. Initially, the main physiology is starting from the entry of sodium inside the cell, right? Yes or no? Initially, the main propagation is starting from the entry of sodium through the voltage gated sodium channels. Okay, we have some drugs which will inhibit the sodium channels. Voltage gated sodium channel blockers बोलते. We have some drugs which will inhibit the first step of activation of presynaptic nerve. In that we have carbamazepine. We have topiramate. We have oxcarbamazepine. We have zonisamide. कितने हो गए? 1 2 3 4. Carbamazepine, oxcarbamazepine, topiramate, zonisamide, and we have lamotrigine, newer drug, lamotrigine. We have phenytoin, and valproate. So all these drugs, carbamazepine, topiramate, oxcarbamazepine, zonisamide, lamotrigine, phenytoin, and valproate, sodium valproate bolte. These all drugs, how many? Total 7 drugs. These drugs will inhibit voltage gated sodium channels. This is the mechanism of carbamazepine. See, these drugs are not only having single mechanism, ये drugs का दूसरा mechanism भी है. But remember, voltage gated sodium channels को कौन inhibit कर रहा? Carbamazepine, topiramate, oxcarbamazepine, zonisamide, lamotrigine, phenytoin, and valproic acid. Clear, everybody? Understood this drugs mechanism? Now, second one, what is second mechanism? In second process, after entering sodium into the cells, high voltage gated calcium is getting activated, right? So some drugs should inhibit this channel also. So here we have some drugs like lamotrigine and topiramate, gabapentin, and pregabalin. 4 drugs. Gabapentin and pregabalin, lamotrigine and topiramate. These 4 drugs will inhibit high voltage gated calcium channels. The second mechanism. प्रीवियस फिजियोलॉजी में कैल्शियम इस तरफ ड्रा किया था, सोडियम इस तरफ ड्रा किया था. कंफ्यूज नहीं होना. ओके, यू शुड नॉट कंफ्यूज. प्रीवियसली व्हाइल एक्सप्लेनिंग द फिजियोलॉजी, आई हैव ड्रॉन सोडियम इन द लेफ्ट साइड. नाउ आई हैव ड्रॉन सोडियम इन द राइट साइड. कंफ्यूज नहीं होना. नो वन इज कंफ्यूजिंग नो हियर. ओके, वेरी गुड. Second stage you understood. Okay, activation of high voltage gated calcium channel. This high voltage gated calcium channel is inhibited by lamotrigine, topiramate, gabapentin, and pregabalin. Okay, done. Now you see, I told one more point. When calcium enters inside the cell, immediately the vesicle which is containing glutamate is ruptured and it will release glutamate, I told. And this glutamate vesicle is ruptured only upon activating SVA receptor. We have a very particular drug which inhibits this SVA2 receptor. The drug which inhibits this SVA2 receptor, not SVA2, it's SV2A receptor. SV2A receptor inhibitor is levetiracetam. Levetiracetam. Levetiracetam will inhibit SV2A receptor, and by that, what it does, what will happen if levetiracetam inhibits this receptor? What will happen? Glutamate will not be released. Excitatory neurotransmitter is not releasing. Okay, so levetiracetam action is this. Levetiracetam inhibits SV2A receptor. Okay, I think you all are confusing. I'll try to draw in next slide. Okay, I think you all are following me, right? कि कोई किसी को doubt है तो you should ask me. Okay, we understood the sodium channel, we understood the calcium channel, we understood the SV2A receptor, and here we stopped the release of glutamate. Okay, I am explaining the different strategies and different drugs. See, here we have AMPA receptor and we have NMDA receptor, AMPA receptor and NMDA receptor. Glutamate is binding on AMPA receptor and NMDA receptor, right? Competitively, there are some drugs which will inhibit glutamate on these receptors. In that, especially on AMPA receptor, we have topiramate, topi जैसा जाके topiramate में बैठ जाता, topi. On AMPA receptor, topiramate will go and bind on the AMPA receptor, and it will competitively block this receptor, and through that, what it does, it will stop the action of glutamate on AMPA. And on NMDA receptor, again on NMDA receptor also competitive blockers we have Phenobarbitone. I'm sorry. Phenobarbitone is one drug which will inhibit NMDA receptor, and through that what it does, it will stop the binding of glutamate on the postsynaptic nerve, and by that it will stop release of, or it will stop the entry of calcium. And here we have special type of T-type calcium channels. Here these T-type calcium channels are inhibited by valproate, Zonisamide, and these two drugs, valproate and Zonisamide, will inhibit the T-type calcium channels. Okay, and now let's go here. GABA, here inhibitory neurotransmitter GABA will come and it will fall on the complex receptor. Here we have barbiturates will fall on barbiturate side, benzodiazepines will fall on benzodiazepine side, and GABA will fall on GABAergic site, and these three activation, it will cause entry of chloride ions. So here direct action is there for barbiturates, benzodiazepines, and GABA analogs. GABA analogs are not only inhibiting the calcium ions here, GABA analogs are inhibiting, they are binding on direct GABA site also. Okay, they are having two actions. And here I told you GAT1 channel, which is reuptaking the GABA. GABA is reuptaken by GABA transporter 1. We have some drugs which will inhibit this GABA transporter 1. And here we have Tiagabine. Again, Tiagabine will inhibit this GABA transporter 1. When Tiagabine inhibits this transporter, what will happen? GABA will not be reuptaken. GABA activity will increase here, no? GABA activity बढ़ गया तो we can easily decrease the excitatory actions. Okay, that is another Tiagabine action on GAT1 channel. And here we have one special enzyme which metabolizes GABA. GABA को metabolize करने वाले का enzyme का नाम क्या था? GABA transferase. And this GABA transferase is inhibited. This GABA transferase is inhibited by Vigabatrin. Vigabatrin will inhibit this GABA transferase, and what will happen? GABA will not be metabolized. GABA concentration again increases in GABAergic nerve, and again GABA will release. So GABA activity बढ़ाने की कोशिश कर रहे हैं अपन इधर. Understood? So these are different mechanisms of different drugs. I think you all understood. Here barbiturates and benzodiazepines in previous classes we have already discussed, and remaining all drugs I think you understood. Okay, Phenobarbitone, valproate and Zonisamide will inhibit the T-type calcium channels. Okay, I think you all understood. The एक बार दो बार में नहीं आ जाएगा. You should keep revising all these drugs and their names. Now, I think you all understood the mechanism of action of each drug in seizure. Seizure के अंदर, see the drugs what they are doing. Either we are increasing the activity of GABA or we are decreasing the activity of glutamate. ग्लूटामेट एक्टिविटी को डिक्रीज कर रहे हैं एंड गाबा एक्टिविटी को इंक्रीज कर रहे हैं. क्यों? बिकॉज इन कन्वर्जन्स और इन एपिलेप्सी और इन सीजर्स glutamate activity was increased and GABA activity was decreased. So what we are doing, we are giving the drugs and we are trying to increase the GABA activity and decrease the glutamate activity. Okay, so this is the objective of each and every drug in pharmacology. Now you see, if anybody is having epilepsy or seizure, for epilepsy and in seizure we have 3 to 4 different treatment strategies. 3 to 4 different strategies. Actually, before treating the strategy, let me tell you some diagnosis का कुछ नहीं है. The epilepsy and seizure diagnosis is mainly done on patient's symptom directly. Symptom is telling directly that patient is having seizure. Along with this seizure, we need to know what is the exact cause. For that, what we have to do, we have to perform patient's MRI. We have to perform patient's CT. MRI will explain at the vascular or trauma or any destruction in the brain के अंदर कुछ भी destruction है, cancer है, कुछ भी है, पता चल जाएगा. Okay, and sometimes we'll perform EEG, electroencephalogram. This EEG, electroencephalogram, will explain the excitations of rapid production of action potentials. Action potentials कौन से part of the brain से produce हो रहा है, that we can see, we can find. Okay, and sometimes the glutamate activity, sometimes the production of GABA activity. Okay, GABA activity कम हो गया या glutamate activity बढ़ गया, with that also we can say that patient is having seizures or epilepsy. Okay, fine. If patient's condition is diagnosed with seizure, so seizure patient is having 3 to 4 treatment strategies. First one, patient is having convulsions, so we have to go with anticonvulsants. And this anticonvulsant treatment should be given to stop convulsion for the patient next time. Next convulsion stop करने के लिए देना है. And this anticonvulsant therapy should be given to reduce the patient's next convulsion and reduce adverse effects. Adverse effects कम करने के साथ साथ we have to decrease the further development of seizures in the patient. That is first strategy. That is anticonvulsant pharmacotherapy. Anticonvulsant pharmacotherapy. Number 2, we have next strategy, surgical strategy. Okay, surgery. If patient is having compression, if patient is having hemorrhagic stroke, or if patient is having ischemic stroke, in that cases we have to go with surgery, decompression surgery बोलते हैं. In that we have to decrease the pressure from the cranial tissue, and by that we can decrease the patient's convulsions. And third strategy what we have is we can go with stimulation techniques, stimulation of GABA activity or stimulation strategies. And fourth, we have some dietary habits. Okay, in dietary modifications, ketogenic diet करके है, ketogenic diet. Okay, some ketogenic diets are also used in some epilepsy patients to decrease the seizure episodes. Actually, ketogenic diet, all these treatment strategies I'll explain in the next class, starting from pharmacotherapy. In pharmacotherapy, I will explain the drug information of important drugs. Like I will explain you the drug information of Phenytoin, very important drug. I'll explain about valproate, carbamazepine. Okay, let me tell you some adverse effects of these drugs. याद रख लो, ये बहुत important है, adverse effects. Some drugs like Phenytoin. Have you heard about Phenytoin? In hospitals you might have seen Phenytoin. Yes sir. Phenytoin का adverse effect क्या है? Phenytoin especially it causes gingival hyperplasia or gingival bleeding, gingival hyperplasia. And Phenytoin has one of the important characteristic feature is it will cause hirsutism. What is hirsutism? Development of hair in the females wherever possible. Okay, so gingival hyperplasia and hirsutism is very very important adverse effects. ये याद रख लो Phenytoin का. And see, most of the anti-epileptic drugs will cause sedation and hypnosis. Sedation कौन कौन cause करता? Barbiturates, benzodiazepine, GABA analogs, Phenytoin नहीं बोल सकते, but most of the drugs will cause sedation. Sedation is very common adverse effect with most of the anti-epileptic drugs. Gingival hyperplasia, hirsutism with Phenytoin, and very importantly, hyponatremia. Hyponatremia is caused due to carbamazepine. कार में लेके सोडियम चुरा लिए, कार में सोडियम चुरा के लेके गए. Okay, carbamazepine will cause hyponatremia. And there is one drug which will cause visual impairment. Visual impairment कौन cause करेगा पता है? visual impairment, Vigabatrin, याद रख लो. visual impairment, Vigabatrin. ये important points है. you should not forget. Okay. And sometimes cognitive impairment तो ये सब ड्रग्स करेंगे, but most importantly topiramate will cause cognitive impairment due to the inactivation of AMPA receptor, because it is a टोपी जैसे जाके बैठ जाता ना. Okay. So these are important adverse effects. And एक final valproic acid का adverse effect कोई बोलेगा? Valproic acid, it will cause weight gain. And along with this, there are so many important adverse effects we'll discuss in the next class.